Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today on Face the Facts, we're getting ready for wedding season, and I just want to talk a little bit about what areas you might want to consider to treat with neurotoxin, aka Botox, Dysport, etc., before your wedding. Now, usually I try to tell my patients I would love for them to come in about a month before the actual big day, because that allows us to get time for it to work, usually a couple of weeks, and then also still come back and get a little tweak in case something wasn't totally the way we want it. So that's what I tend to recommend for people, but I would say at the very least, definitely try at least 2 weeks, because you do want to make sure it's totally in. The other thing too is, of course, you want to make sure there's no risk of any bruising or anything unusual that could have happened to ruin your big day. But otherwise, what I try to suggest for patients are, this is not the time to experimenting with Botox that you've never had before. So especially with things around the mouth, if you've never had a lip flip, if you've never had DAO Botox, this is not the time to try it, because it might impact your smile or the way you talk, and that's the last thing you want to be worrying about on your big day. But common areas I tend to suggest are treat the glabella, because this area is what gives someone the angry, frowning, concentrating appearance, and no one wants to look angry on their wedding day. So you might as well just soften that area a little bit, so that way at least you look a little bit more fresh and happy maybe. Another common area is the crow's feet around here, because hopefully you're smiling a lot for your big day, and so that can sometimes accentuate out those lateral crow's feet. So doing a little bit of Botox there to help soften that can be really nice for photos. I do caveat you want to be a little bit careful about not coming too low, because then that can again impact your smile, and we don't want to do that at all on your big wedding day. Another area I will say is for the forehead, you do want to be careful, because injecting too much in the forehead can lead to brow drop, which again is the last thing you want. You want your eyes to be nice, bright, and open. So usually I will suggest either completely foregoing the forehead one, or going really light, gentle, just so we get a softening effect, but it's not totally no wrinkles, no movement, fake, and possibly dropping down the eyebrows. If you have done other areas of the face before, like the platysma, the DAO, lip flip, bunnies, anything else that might be a little bit more fancy, and you know your dose, then you can also add those on as well. But for a very basic wedding look, that's what I tend to suggest for my patients. So in summary, wedding season, it's coming up. Talk to your injector, talk to anyone about what might be a good option for you, and see what you can do to get your best looking photos and get you looking as happy as you can for your big day. And this is Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Congratulations on the nuptials. We'll see you guys next time.